There are many different kinds of problems people come in with, and at every session we ask patients, what problem or problems do you want my help in solving today? And we tackle 1 or 2 or 3 problems. If this were to have happened to a friend of yours, what would you say to your friend?
I would say, what is it that you have to do? Why don't you start with a few things? Start with take the first 3 things and do those. And then you will probably feel better about doing number 4, 5, and 6.
Boy, that's terrific. How about if we have you write that down? So when I feel overwhelmed in the morning, tell myself, just to get started with the first 3 things. Don't focus on the whole list. Kind of breaking things down so it seems a little bit more manageable.
What you just said, Judy, seems doable, and it seems constructive. It seems like something I could manage.
Yeah. And when you think about that, how helpless do you feel?
Not as helpless.
Not as helpless.
Not as helpless.
Right.
You're right.
There are several types of talk therapy that can be helpful in the treatment of depression. Cognitive therapy is one type that has been shown through research to be effective for some individuals.
This kind of therapy is called cognitive therapy because cognitive refers to thinking. And one symptom that every depressed patient has is distortions in their thinking. One of the first things that we have to do is to help patients understand just because I think something doesn't necessarily mean that it's true.
It wasn't my regular route. It was off the beaten track. It was out farther. It would have been a couple hours. And I just didn't go.
So just before you picked up the phone to cancel, what was going through your mind?
My husband was in the hospital. I was thinking to myself that, what if something happened to me? You know, I was thinking, well, maybe I got a flat tire. I'd be stuck on a road where I don't know anyone. Of course, I have a cell phone.
Right.
But I did have catastrophic thoughts.
The first thing that we have to do is to teach patients to identify their depressed thinking. So we tell patients, when you're starting to feel more down, more depressed, more hopeless, more blue, is to stop and ask yourself, what was just going through my mind? Then we teach them how to evaluate their thinking. We don't tell them, no, your thinking is depressed, your thinking is wrong, but we have patients examine the evidence. What's the evidence that this thought is true? So the next time you're in the same kind of situation where you feel as if you have some challenge and you just can't do it, or if you try to do it, some catastrophe will happen. Could you ask yourself, gee, what's the evidence that this is going to happen? Am I catastrophizing?
That's a good question.
Cognitive therapy can be used either with or without medication. Many patients do better with a combination of the two. However, when patients take medication alone, they don't really learn new skills that they need to prevent a future episode of depression.
What's interesting is why is it happening again? I mean, why aren't I able to overcome that?
Well, everybody who has problems with anxiety and problems with depression has exactly these kinds of thoughts. Now, the good thing is that what you've learned in treatment before, and which I'm reminding you of today, is while you can't stop these thoughts from coming into your mind, once you start to feel bad, you can figure out what you're thinking and then respond to the thoughts. You don't have to be so helpless in the face of these thoughts. Cognitive therapy is designed to be short-term. We are teaching patients skills that we hope they'll use for the rest of their lives. And before treatment is over, we spend a lot of time on relapse prevention. We talk to patients about what are the early warning signs that you might start to get depressed again. What do you need to do?
I'm so glad I came.
I'm so glad you came too. That's
you're here.
wonderful. All right, but before you go, we still have to do a couple of things. One is, let's talk about what would be helpful for you to do for homework. So you have lots of good notes here. What do you want to do with them?
Well, I think that what will happen every day is when I get up to just think about what I'm going to do and make sure that I do them in small chunks at a time.
Okay, that's great. And it's important that they learn things in every therapy session so that they can make small changes at home every day, small changes in how they think and small changes in what they do. And this is how people get better.